Hi, my name is Elaine, and this summer I worked on my project, MRI texture analysis for predicting multiple sclerosis progression in clinically isolated syndrome, under the supervision of Dr. Liang and Liang. So to begin, what is multiple sclerosis? So MS is a chronic demyelinating neurodegenerative disorder, meaning that the immune system mistakenly attacks the protective coating called myelin that wraps around neurons in the central nervous system, which is comprised of the spinal cord and the brain. This causes a wide range of symptoms, including muscle weakness, vision loss, poor coordination, and cognitive impairment. 85% of MS patients actually first experience disease onset through clinically isolated syndrome, which is a single attack on the central nervous system, making CIS an area of interest in early MS treatment. So in CIS, MRI is useful for visual confirmation of the locations of lesions, which are areas of damaged tissue. On the right, the T2-based MRI sequencing highlights lesions, but on the left, FLAIR-based MRI further clarifies the lesions by suppressing signals from the cerebrospinal fluid in the brain. The MS disease course is highly variable, making it challenging to identify robust markers that predict progression. So texture analysis, an emerging method that quantifies gray level pixel patterns, can capture subtle tissue characteristics on MRI images that are invisible to the eye. So in particular, phase congruency is a parameter that is highly sensitive to sharp changes in pixel intensity, making it especially informative for detecting lesion markers that may predict progression. So as seen in the figure, phase congruency applied to an image of a boat enhances the sharp edges and the fine features. So by applying texture analysis to MRI images of CIS patients and comparing texture measures between those who progressed to MS versus those who didn't, we hope to evaluate the use of texture analysis in identifying lesion markers that predict disease progression. Our cohort of 179 CIS patients with T2 and FLAIR-based MRI images included 33 who progressed to MS after 5 years and 146 who did not. Also, 72 were male and 107 were females. So we had 4 key stages: image preprocessing, lesion segmentation, texture calculations, and data analysis. For preprocessing, we did bias field correction, which removes non-uniform intensities. We also extracted the brain, stripping the skull from the images. To segment lesions, we first ran the MRI images through a pre-trained deep learning tool called TrueNet. This generated probability maps of lesion locations as seen on the left of the figure, followed by manual refinement to produce the final maps like the one on the right. Then we extracted phase information from MRI images and produced texture maps that highlight the edges and the structures of the lesions. We focused on 2 parameters: phase congruency, which reveals the location of edges and structures, and weighted mean phase, which gives more information on the strength and intensity of texture. For our analysis, we implemented 2 models that used ANOVA tests to compare progression groups. So the first was a mixed effects model, which accounts for repeated measures per patient, since most had more than 1 lesion. This model captured both within and between patient differences. Then we also used a patient-wise analysis, which averaged all lesion texture measures within a patient into one value, reducing the model complexity and allowing for easier comparisons. So for our results, we did not observe a significant difference in texture measures between progression groups, as seen in the graph, but as highlighted in the table, we did find incidental differences in texture between males and females across both analysis models in FLAIR-based MRI images specifically, not T2-based MRI. So to conclude, there were no significant differences in texture between CIS patients who progressed to MS after 5 years and those who did not. However, the incidental sex differences indicate that FLAIR-based MRI texture measures specifically show promise in capturing meaningful biological variation. It's also important to note that the comparison groups were very different in size: 33 who progressed versus 146 who did not, which limits the statistical power. So we are currently completing the analysis for our entire dataset of 331 patients. It would also be meaningful to analyze the texture of normal appearing white matter, which looks normal on MRI images but has been shown to have subtle microstructural damage that may impact MS progression. I would like to thank Dr. Zhang and Liang for supervising this project, as well as the collaborative efforts of lab members Xing and Cheyenne. I would also like to thank the Hotchkiss Brain Institute for funding this project. Thank you for listening to my presentation.